And hello again, everyone. Good morning from sunny California here in San Jose. Welcome to today's presentation on the use and benefits of functional electrical stimulation, also known as FES, after a spinal cord injury. My name is Franklin. I'm one of the two co-founders of the Northern California Spinal Cord Injury Foundation, also known as NorCal SCI, and we're the organization that presents these events for you folks. We're grateful to the Christopher and Dana Ree Foundation, whose funding has enabled us to support all of our presentation. And let's get sort of started. A couple of points that I want to make with everyone. Everyone has been muted in order to eliminate any background distractions. And we will have a Q&A session once Jennifer is finished with her presentation. So I will be fielding any questions that you may have through your the chat feature on your screen. So just feed those to me throughout the presentation, and I'll ask the questions from Jennifer at the end. The second thing is, as always, we are recording all of our presentations, including this one, and that way, if you need to jump off this call at any particular time, you won't have to worry about missing out on anything, or if anyone that was not able to join us today. We will be sending an email out to everyone who registered for this presentation first thing tomorrow morning with a link to the video recording of this presentation. So no worries at all about missing a thing. Okay, so let's get started. Let me introduce Jennifer to everyone, and she's got a pack full of information for everyone to share on FES. She received her doctorate in physical therapy from Chapman University in 2008 and has 12 years of experience as a physical therapist. For the last 5 years, she has been part of the therapy team at the Spinal Cord Injury Rehabilitation Unit at the Santa Clara Valley Medical Center, one of the top SCI rehab hospitals in the US. She has advanced certifications in exoskeleton functional electrical stimulation use, in exoskeleton and functional electrical stimulation use, with hundreds of clinical hours and clinical application hours across spinal cord and other neurological injuries. Her clinical skills have been developed across many areas of PT, including acute care, cardiac rehabilitation, orthopedic, and most recently, spinal cord injury rehabilitation. And I am thrilled to have Jennifer back. This is her fifth presentation. So just so that as a point of reminder, all of her past presentations are available on our website. If you go to our website under the sort of the video features that we have, the video tab, you'll see a link under educational virtual series. So all of our previous presentations on various types of electrical stimulation, including TENS, NMES, and the whole sort of practices, best practices on how to use FES are on there. And I encourage you strongly to sort of refamiliarize yourself with her past presentations, because once you watch everything, it'll give you a really complete and 360-degree view of what Jennifer's presentations are all about. So Jennifer, take it away, please.
Thank you. Good morning, everyone. I just want to kind of reiterate what Franklin said. I am not going to be talking about in this presentation a lot of the safety in terms of skin checking and autonomic dysreflexia and things like that, because I covered that in my first presentation. So if you are looking to use FES, I highly recommend looking at my first presentation, because it gives you kind of a lot of the background information in terms of electrical stimulation. All right, so let's get going. All right, so this morning I will speak to you about the use of functional electrical stimulation and how it can be helpful after a spinal cord injury. Just to fully disclose, I'm going to be speaking about 4 different companies that are FDA approved in the United States. I do contract with one of them. I contract work with Restorative Therapies, Inc. out of Baltimore, Maryland. I set up their devices. I do home setup in California. I am one of their installers. So I will give you an unbiased opinion on all of the equipment, but I did just want to let you know that I do work for Restorative Therapies. All right, let's get going. All right, so our session overview. What are we going to be talking about this morning? So I'm going to overview functional electrical stimulation and what it is. We're going to review the changes to the cardiovascular system, circulation, bone density, and spasticity after a spinal cord injury, and how we can use FES to help improve or maintain these different systems. I will discuss the FES devices that are currently available and FDA approved in the United States. I do want to kind of throw out there for anybody who's joining outside of the US, there are different devices that are approved in different countries. I won't be speaking to those because I don't know much about them, but you can absolutely look into them. And then I'll give an overview of the referral process and insurance coverage and kind of how to get an FES if you're interested. So what is FES? Functional electrical stimulation. It sends electrical impulses through the skin and it targets the motor nerve in the body that causes the muscle to contract. So my last presentation, I talked about neuromuscular electrical stimulation, and it's the same exact concept. It sends impulses deep into the muscle and it causes it targets the nerve and causes the muscle to contract. What makes something an FES system is that multiple muscle groups are targeted during a functional movement or task or exercise. So an NMES device that you would buy online through Amazon, anybody can go and purchase one of those and you can put it on one or two areas of your body and you can get some stimulation. An FES device is actually an FDA registered medical device because it contracts multiple muscles at the same time during a functional movement. So it has to be monitored and it has to kind of come through a clinical pathway. So just really quickly, when electrical stimulation is not safe to use, if you have an implanted cardiac pacemaker or defibrillator, pregnancy, an unhealed fracture or muscle tendon or tears, if you have epilepsy, malignancy, which is cancerous tissue, open wounds or skin damage in the area that you would be applying the electrodes, recently implanted plates, screws, or other metal or hardware. Most of the research says recently implanted means 3 months, and never over the front of your neck. When should a physician be consulted prior to the use? If you have severe spasticity, you definitely want to talk to your medical team about using FES. Heterotrophic ossification, which is that extra bone growth that happens in the joints after spinal cord injury. A lot of times it happens in the hips after spinal cord injury. Severe osteoporosis, so really weak bones in your body. Severe joint contractures or limited range of motion. Cardiac or respiratory disease or instability, and if you have an active infection like a respiratory infection or a urinary tract infection. So why would we use FES after a spinal cord injury? There is a ton of research out now that shows that long-term use of FES has significant benefits to the body after spinal cord injury. Using FES can positively affect muscle strength, cardiovascular endurance, circulation, bone density, and muscle tone and spasticity. Research has shown these improvements and these benefits across complete and incomplete injuries, including quadriplegics and paraplegics. It doesn't matter where the injury level is in your body. The only thing that's important, which I talked about in one of my first presentations, is that you have to have an upper motor neuron injury. So what that means is that your spinal cord injury has to be kind of above anywhere from that T12 to L2 area because your peripheral nerves need to be intact. If that doesn't make sense, I will refer you back to one of my first presentations and I talk about it a little bit more. One of the other things that I want to kind of put out there in terms of the benefits of FES is that it does require regular use. It's just like going out for a regular bike ride or a walk. If you just do it once, you're not going to see the benefit. The benefit comes when you use it regularly. So in terms of regular use for FES, a lot of the literature shows that 3 to 5 days a week for 30 to 60-minute sessions is what you would need to do to see these benefits. So now I'm going to talk through the benefits and kind of what happens to the body after spinal cord injury and how FES can help. So after a spinal cord injury, the heart and lungs, they lose their strength and function if they aren't stressed. The heart and lungs are muscles, just like other muscles in our body. And if we're not strengthening them, then they do get weaker. And to strengthen the heart and lungs, you need cardiovascular exercise. So you have to achieve an elevated heart rate and respiratory rate, and multiple muscles need to work in combination in order to strengthen your heart and lungs. So after spinal cord injury, cardiovascular exercise does become very challenging. Some people can get in the pool and swim. Some individuals are able to walk and keep up their previous cardiovascular routine, but it does become a big challenge. So this is where FES can kind of come into play. FES places an increased demand on the heart and lungs because it allows for repetitive muscle contractions during a functional task. So say you're getting on an FES bike and you're cycling for 30 minutes using electrical stimulation, that's actually strengthening your heart and lungs, and you will see that long-term carryover if you use it consistently. So circulation after spinal cord injury is another really big area that tends to take a big hit and decrease. So normally our blood circulation in our body relies on our muscles that surround the veins to kind of pump the blood back to the heart. So in this picture here, the blue kind of tube is your vein, and that's where your blood is. And the red areas on the sides, those are the calf muscles. So as the calf muscles contract, it pushes on that blue tube, that vein, and it throws that blood back up to the heart to help recirculate that blood. Well, after spinal cord injury, if your muscle isn't contracting, then there's nothing pushing on that vein to help the blood go back to the heart. So if the muscle is weak or paralyzed, the circulation slows down and that blood pools down in your veins. So in both complete and incomplete injuries, we see decreased circulation. So common complications caused by poor circulation can be blood clots, orthostatic hypotension, which is that low blood pressure when you change positions, and also skin issues in terms of wounds and skin breakdown. So how can FES help with circulation? So again, FES allows for repetitive contraction to a lot of muscle groups over an extended period of time. So it can help prevent a blood clot by contracting those muscles and helping to move that blood through the veins and back to the heart so that blood doesn't pool and kind of get stuck or clot in those veins, usually in the legs or the feet. FES use can help prevent orthostatic hypotension, which is that drop in blood pressure when you change positions, because it prevents that pooling of blood in the legs. So a lot of times, if you're laying down and then you get up to a sitting position, you rely on that muscle contraction to get that blood back to your heart. If you have weakness or paralysis, that blood doesn't go back to your heart. And that's why a lot of people start to feel dizzy or lightheaded when they change positions, because all that blood goes from the top of their body and their brain all the way down to their feet, and it just hangs out there. So the use of FES and that repetitive stimulation can help improve kind of the blood pressure with changes of position. The other thing that FES can really help with in circulation is preventing pressure sores and skin breakdown. So pressure sores and skin breakdown are a huge issue in the spinal cord injury population. And it's because, again, your circulation slows down. So for skin to be healthy, you need regular blood flow to it. And if the blood flow slows down in that area, the tissue starts to kind of die because it doesn't have the blood flow and circulation that it needs. So the research has shown that by improving circulation using FES, you can decrease your likelihood of getting a pressure sore or skin breakdown. So one of the other areas that FES has been shown in the research to improve is bone density. So active muscle contractions, so the pulling of your muscle on a bone is what strengthens the bone. So if I bend my elbow and use my bicep, the bicep pulls on my humerus, which is my arm bone, and that's how that arm bone gets stronger. So if I don't have the muscle pulling on my bone, then my bone density or my bone strength decreases. So if you have weak or paralyzed muscles, you're not placing stress on that bone, and you are at a good chance of getting a decreased bone density. So again, bone density is greatly decreased in the spinal cord injury population, again, in both complete and incomplete injuries. Common complications caused by decreased bone density include osteoporosis, which is the definition of weak bones, pathological fractures, meaning the bone just breaks in your body. So even if you're just sitting in a chair and you go to reach for something, if you move wrong and you have a weak bone, you can have a fracture. And postural deformities. Our bones are what keep us upright. So if our bones are weak and they start to change positions, then our posture can change. So FES has been shown in the research to improve bone density after spinal cord injury. So again, because we're getting repetitive muscle contractions using the electrical stimulation, it can pull on that bone and help to maintain or even increase the density of that bone. Now, early on, I said that osteoporosis is something that you would want to talk to your doctor about before you used FES, and that is accurate. If your bones are so weak and you start to use FES right away, it could cause a fracture because your body isn't ready for it. So we want to use FES to prevent osteoporosis, but if you already have very weak bones and a decreased bone density, you want to talk to your doctor first to make sure that it would be safe to use FES. So another way that FES can help after spinal cord injury is your muscle tone. So muscle movements normally occur when the brain relays a message through the spinal cord, and then that spinal cord tells the nerve, and then the nerve tells the muscle to contract. So after a spinal cord injury, this pathway is impaired because the spinal cord is injured. So sometimes you get these abnormal muscle contractions or changes in your muscle tone. So those abnormal muscle contractions are what people would call spasms or spasticity. And muscle tone can refer to the fact that either a muscle is way too tight or way too loose. So some people end up with contractures or really tight muscles in their body, and some people's muscles get really, really kind of floppy and loose, and their joints get really loose. So after spinal cord injury, involuntary contractions of the muscle may occur. And again, we're talking about occasional muscle spasms or constant spasticity and tightness. So FES can help improve or maintain your muscle tone after spinal cord injury because it again applies that repetitive stimulation to multiple muscle groups over an extended period of time. So what does this mean? This means that if you're getting contractions in your muscles while you're riding a bike or you're riding an arm cycle or you're using a glider, that repetitive muscle contraction, it can actually stop or fatigue those involuntary muscle contractions that you're getting, like that spasticity or that high tone. So research has shown that regular use of FES can help to decrease spasticity and improve kind of resting muscle tone in individuals after spinal cord injury. So those are kind of the reasons why you would use FES. What I want to kind of spend the bulk of this presentation on is how to get an FES, where to find one, what is available to you. So here we go with that. Here I will talk about the availability of FES units. So like I mentioned earlier, FES units are an FDA registered medical device here in the United States. So you cannot just go and purchase an FES device on the internet, or you can't just contact the company and say, hey, I want to purchase a piece of your equipment. Here's my money. Can I have my device? Because they're medical devices, they do require a physician prescription and a letter of medical necessity, an LMN. So what you need is you need your doctor to write a prescription just like they would for a medication, and it would need to have the device on it. And then you also need a letter of medical necessity. So here's where I'll kind of talk as a physical therapist. I will let you know that most physicians don't write the letters of medical necessity. The letter of medical necessity is generally written by a physical therapist. Physical therapists are the individuals that would use FES devices with their patients and clients. So letters of medical necessity can be anywhere from 4 to 20 pages long. They definitely take some time, but they are required and they are really beneficial if you're looking to get an FES cycle. If you're looking to just cash pay and purchase the cycle, they're not as important. But if you're looking to go through the insurance route, a good letter of medical necessity is very, very important. So having a therapist who knows what needs to go into that letter of medical necessity is very important. The other thing is that the companies that offer these FES cycles, they want you to have their cycle. They want you to have their piece of equipment. So they do offer a lot of times templates that therapists can use to write a letter of medical necessity. So if your therapist doesn't have a lot of experience writing something like this, most of the companies offer templates that you can follow to kind of get into that letter what you would actually need. So these devices, FES devices, are purchased through private companies. Again, they cannot be purchased online. If you are on Amazon and you see something being displayed as an FES device, I want you to know that it is not a legitimate FES device. It's probably a neuromuscular electrical stimulation device, an NMES device that they are calling or titling FES. An FES device will, again, not be seen online. It can't just be directly purchased. It has to come through a medical pathway. The other thing in terms of availability of FES devices they are quite expensive. They have a huge price range, but they cost the amount as a car sometimes. The average price range for the devices that I'm going to talk about today are anywhere from $8,000 to $20,000. And it depends on the company that you're getting it from. It depends on the setup, the shipping, the different components that you would want or need on the device. So there's a very big price range. In terms of insurance coverage for FES units, it has to be considered medically necessary. And I wish I could tell you that if that was the only thing. I wish I could say if it's medically necessary, you can have one. Unfortunately, that's not the case. Insurance has not jumped on the bandwagon in terms of covering FES devices. There's two insurance kind of pathways that will cover FES devices most of the time, and that's workers' compensation and the VA. They tend to offer very good coverage options for FES devices, but coverage varies with private insurance and companies, and coverage is non-existent for Medicare and Medi-Cal, I can tell you. I have submitted, I don't know, maybe less than maybe 100, letters of medical necessity, and very few of them do get covered by insurance. So I can say we definitely submit as therapists, we submit letters of medical necessity and we go through this process to try to get the insurance coverage, but a lot of times we do get denials. The one other thing that I do want to point out is the insurance process and coverage is very, very long. So I have had patients who I submit insurance for, and a year later, they tell me they got their device. So it's not always a quick process. Most of the times when a FES unit is submitted to insurance, insurance denies it right away. And then there's a process that you have to go through to see if they will then cover it in the long run. So they usually always deny it the first time, and then there's a process that the company goes through with you. One great aspect of most of these companies is that they do have people on their staff that will help you through that insurance process. And most of them will say once everything's submitted, they will kind of fight through the insurance process for you so that you don't have to be the one that does it. The other option in terms of getting a device like this is using cash pay, just paying for the device on your own. You know, there are grants, fundraising, financing available. Most companies will work with the client on cash payment options if insurance denies the coverage. And I can speak for one company. I don't know about the other ones, but I do know that one of the companies, if you cash pay for the device, they will continue to fight insurance for you. And if insurance eventually does cover the device, then they will pay you back for what you paid initially. So there are some options out there. In my experience, I have had a lot of patients pay cash for them. I have had a lot of patients use their fundraising funds to get them. Unfortunately, a lot of the grants that are out there aren't substantial enough to cover a device like this. When we're talking about, a $10,000 to $20,000 device, a lot of grants and, that kind of thing that's out there is not that high in price. So you would have to use money also. So in terms of finding FES devices in the community, I want to kind of make it known that it is very important to trial any of these devices before you're going to get one for home. You have to have a doctor's prescription, and the therapist has to write a letter of medical necessity anyways. So you have to show that you've used this device and that it works for you. So a lot of times when I'm writing my letters of medical necessity, my patients have been using these devices for, anywhere from 5 to 20 trials, so that I have data that I can put into that letter saying, yes, this worked for this person. This is something that is medically necessary. You should cover this. So this is kind of the hardest part for people sometimes is, well, if I need that experience in using the device, where can I find it and how can I get that experience so that I can actually get my hands on one and get one for home? So how can you find a device near you? If you contact the company directly, they can tell you if they have a device at a facility near you. A few of the companies, I have their websites linked coming up in the next slides. A few of the companies, if you go on to their website, they actually have a list of where their device is and what clinics they're at or gyms. So you can use that list to kind of find if there's a device near you. A lot, but not all, of rehabilitation hospitals and neuro outpatient clinics do have these devices. The one thing that I want you to know about that is if you are going to use one of these devices in a hospital or an outpatient clinic setting, it does require a physician's referral to be seen by the physical therapist there. So where I work, we have FES devices, but you have to be referred to physical therapy to use the device. One of the other downsides of this is that insurance, unfortunately, won't pay for you just to come to the clinic and use the cycle on a regular basis because they don't see that as medically necessary. So what usually happens is if we have somebody referred to us because they're interested in getting an FES device, we can write our goals so that we're teaching the patient and the family how to use the device, and then that they can use it over a few sessions, and that would be covered by insurance. So you kind of have to work the system a little bit if you want to get in somewhere and try out one of these devices a few times to see if it's something that you want to go through with. There are also some gym-based programs that specialize in neurologic injury that do have some FES devices. I can't speak to where they are all over the United States or all over the world. I can speak to in the Bay Area here in San Jose, there are a few. So that's something else to look into. Generally, there is a high cost per session of going into one of these programs to use the cycles. So just keep that in mind also. So what to look for when buying or trying, looking for an FES unit. There's a few different areas that I'm going to talk about here, and then I'll talk about each of them with each of the devices that I'm going to discuss. So the number of channels, what that means is how many muscles can be stimulated at the same time. So generally the devices offer anywhere from 6 to 12 channels. So if a device offers 6 channels, that means that I can electrically stimulate 3 muscles on each side of the body when I'm doing my activity. So if I'm riding a cycle and I have 6 channels available, I can have 3 muscles being stimulated on each side of the body. Obviously, the increased number of channels allows for more muscle activation during the functional task. And the more muscles you can activate during the task, the better benefits you're going to see in terms of the circulation, the bone density, the cardiovascular exercise that I spoke of earlier. So the more muscles that you stimulate, the better chance are you're increasing of those benefits that I spoke about. Different FES units offer different functional tasks. So arm cycling and leg cycling are available. An elliptical or like a seated glider is available. And there is one company that has a standing and walking functional task. Something else to think about when you're looking at an FES unit is the footprint of the unit. And by footprint, I mean the size of it. How much space does it take up? I know after a spinal cord injury, a lot of times space in your house can be a challenge. You have other equipment in there, you have chairs, you have beds, you have, all of these things. So to add another device takes up a lot of space. So some of the units have a much smaller footprint than another. So that may be kind of something to look into when you're looking at what device you may be interested in. Another aspect that you want to look into is the clinical and technical support that's available after you purchase the device. Most of the companies do offer this support, and I'll speak about that when I talk about each of the companies. The ease of setup and use is also very important. Does it require a transfer? Can I use this device directly from my manual or power wheelchair, or do I have to do a transfer to a device? Do I need assistance to set up and take down this device? When you're talking about FES and we're talking about putting electrodes on the body and hooking the electrodes up to cables, it takes fine motor coordination. So for somebody who has a paraplegic injury and their arms and their hands are fully intact, you could probably set yourself up on an FES unit on your own. But somebody who has a quadriplegic injury and doesn't have that function of their hands would need assistance to set up and take down these pieces of equipment. And then the last thing that you really want to think about when you're looking at one of these devices is the cost of the device, setting it up at home, and then that support that's offered. So the companies in the US with FDA approved FES devices are listed here. I'm going to talk about each of them, and I will discuss what devices each of them offer. Again, I want you to be aware that if you see something titled FES device and it's not by one of these companies, it probably is more of an NMES system, a neuromuscular electrical stimulation system. These are the companies that have FDA approval. Again, if you're joining from another country, there are different approvals in other countries. So these may not be the devices that are approved in your country. You would have to check to see what's available. All right, so Therapeutic Alliances. They're out of Ohio, and they were kind of one of the first people to jump on the scene of functional electrical stimulation. They've been in the market since 1993. So as I go through these companies, I'm doing them in chronological order. So Therapeutic Alliances was the first, and they have this cycle that you see on the screen. It's called the Urgis. So their cycle is a leg bicycle, a lower extremity cycling system, and it offers 6 channels of stimulation. So they provide stimulation to your quadricep, your hamstring, and your gluteal muscles. So it's the 2 muscles on your thigh, the front of your thigh and the back of your thigh, and then the muscles in your bottom, your butt. So there's no changing those muscles that you can stimulate. Those are the 3 muscle groups that are going to be stimulated with this device. It does have a very large footprint. So it's a big piece of equipment, and it weighs over 230 pounds. So it does take up a decent amount of space in your home. They do offer clinical and technical support. So they have a physician electronic prescription station. And what this does is it allows a clinician, whether it's a physician or a physical therapist, to control and monitor the patient's sessions and settings in terms of how the stimulation is being delivered, the intensity, things like that. So somebody can help determine the settings that are necessary for you on this device to get good outcomes, to get good stimulation through the cycle. They also offer technical support available by phone. So if you have this cycle at home and you need technical support, you can call them and they can give you some assistance. This device does require a transfer. So you can't use this device directly from your wheelchair. You do have to transfer onto the device. The armrest moves, so you can get that out of the way for a transfer, and the back of the bike can recline. So there are ways to make the transfer easier if you need to use a slide board transfer or if you're doing dependent transfers into it. But it does require the transfer. There's seat belts and there can be a chest strap. So in terms of stability and managing your posture in it, you can have that external support to help you stay upright. In terms of cost, these devices cost anywhere from $18,000 and up. So I'm not giving you exact numbers because this cycle actually is built per individual. So if this is a cycle that you're interested in getting, there's paperwork that needs to be filled out that are measurements for your body and your body type that is actually sent into the company, and they create the cycle based on the measurements that you send back. So it is individualized to the person who will be using it. So that's Therapeutic Alliance. They're currently on their 4th generation of the cycle. So there have been upgrades made over the years since 1993. This isn't the same exact cycle that they came out with then. They are on their 4th generation. And they do offer a 12-month warranty on parts and labor, but after that, it's up to you in terms of payment if something happens. The other thing that I do want to let you know is that they say that their device is safe to use with strokes, spinal cord injuries, traumatic brain injuries, multiple sclerosis, CP, and really any neurologic injury. So it's not just for spinal cord injury. Most of these devices can be used with any neurologic injury. So that's Therapeutic Alliance. This is the one and only FES unit that they offer. So this is their Urgis. Restorative Therapies is in Baltimore. They have been working since 2004. They offer multiple units of functional electrical stimulation. So they offer a lower extremity, so a leg bike, a leg cycle. They offer an arm cycle, so for arms. They offer a upper and lower extremity glider. So it's the picture in the top right. It's with that big black seat. You can stimulate the arms and the legs at the same time. They offer a supine cycling device, which you'll see in the bottom left. This woman is using the device from a hospital bed. You can either leg cycle or arm cycle from a supine laying down position with this device. And they do also offer pediatric models. So models for smaller frame children or other individuals. Their devices range greatly in terms of price because how many they have. So I'll discuss that on the next slide. So their devices can offer up to 12 channels of stimulation. So they offer anywhere from 6 to 12 channels of stimulation. You and your therapist choose which muscles are stimulated. So you have the availability on these units to stimulate any muscle in the arm, leg, or the core. And generally, the clinician who's helping you kind of work through this process of setting it up and learning what's going to be best for your body will guide you in terms of which muscles are the most beneficial to stimulate. These devices, I would say, have a medium footprint for the cycles, but the glider, the bigger one, it has a large footprint. So they definitely don't take up as much space as the previous device that I spoke of, but they have a medium to large footprint. So you have to have the space for these in your home. Clinical and technical support. They are installed and set up by a trained clinician. Like I said, this is the company that I do set up for. So a clinician comes to your home and sets up the device, sets up all of the settings for you to make sure that the program is appropriate for your body. And they do offer clinical and technical support online or by phone. In terms of the ease of setup and use of these devices, the cycling devices are great. You do not have to transfer onto them. They can be used directly from the manual or power wheelchair. The glider device does require a transfer. So you do have to get out of your chair and transfer onto the device. And then the supine device can be used in bed. I have seen them used regularly in hospital beds. In a regular bed, it totally depends on your bed setup. So sometimes they can be used over a regular bed, but there needs to be enough clearance for the machine to move, the device to move around. So it doesn't work with all beds. Their price range is a big range. It's anywhere from $12,000 to $20,000 because it depends on the unit and the accessories. In terms of just getting an arm bike, it's going to be a lot cheaper than if you get an arm and a leg bike together. I talked about the fact that you can get anywhere from 6 to 12 channels. Well, if you want 6 more channels and you want to stimulate 6 more muscles, that's going to cost you. So these devices are built per individual and the cost goes up as you start adding accessories. It's like buying a car. You get the base model, and then once you start adding the sunroof and the power windows and all that stuff, your price goes up. So same thing with these devices here. So Myelin is out of Florida. They have been working since 2013, and they offer a lower extremity cycling device, so a leg bike. It's called the MyoCycle. They offer 6 channels of stimulation. So again, they offer contraction of the quadriceps, the hamstrings, and the gluteal muscles. So again, those muscles on the front and back of your thigh and the muscles in your rear end. You again can't change which muscles are being stimulated. So it's these 3 muscles that are being stimulated. This device by far has the smallest footprint. So in terms of taking up the least amount of space, the MyoCycle takes up the least amount of space. It is a smaller device and it can fit in tighter areas. The MyoCycle uses an algorithm to customize the stimulation settings and patterns. So while other devices use a clinician to set up the settings and put in the patterns, the MyoCycle actually uses an algorithm. So it's kind of computer generated. So it's based off of kind of the individual that's going to use it, their size, their measurements, and they set up a customized stimulation program for you that way. They do offer clinical and technical support available online or by phone. Ease of setup and use. This cycle does not require a transfer. It can be used directly from your manual or power wheelchair. Again, you have to be able to place the electrodes, plug in the cables. So there is some hand function required if you want to fully set yourself up on your own, but you don't have to transfer onto it. And in terms of cost, their cost is about $8,500. And then you have to include shipping and then set up an installation also. So the price can vary. These devices aren't built per individual. So that's why they do have a lower price point, is that this is their cycle and some things can be changed on it, adapted on it in terms of size, but it's a base model. All right, Sigmetics is out of Ohio also. They have actually been in business since 1988. They are the only company on the market that has FDA approval for a standing or walking FES system. It's called the Step 1. The picture is really small here on the bottom. I'm gonna go to the next slide and then I'll come back to this one. So what I want you to know about the Peristep is it's not a device, a single device like we've seen with all the other devices that I've talked about. It's a bunch of different parts that get put together on you and create kind of this stepping pattern and assist with walking. So all of these little squares kind of that you see, each of these pieces are components to the Peristep and they're used during the walking. So one thing that I want to make clear in terms of the Peristep system is that it's appropriate for those who have standing and walking goals that have been identified by a rehabilitation professional. So this device is not for someone who cannot stand or is working towards standing and walking. So this device is more for an incomplete injury in terms of somebody who's maybe starting to use bracing to stand up and walk or starting to take some steps in the parallel bars or things like that. But this is not something that's safe for somebody who doesn't have that as a identified goal. Whereas all the other devices that I spoke of, any individual with any level of injury can use those devices. So the Peristep system offers 6 channels of stimulation. It stimulates the quadriceps, the muscles on the front of the thigh, the gluteal muscles, the muscles in your bottom, and then it stimulates the lower leg area, and it targets both motor and sensory components for standing and walking. So again, you already have to have some movement in these areas for this device to work. This isn't going to take a completely paralyzed individual and help them stand and walk. This is kind of something that's going to help somebody who is already working towards that. In terms of clinical and technical support for the Peristep, it requires 32 training sessions with a PT. So it's not something that you can just get and take home. It does require a lot of training, and there's clinical programs offered at certain sites with trained staff. So I have never seen the Peristep work. We don't have a Peristep training site anywhere near me. If you go onto their website, they do have a list of where their clinical programs and trained staff are throughout the United States. So you can get a better idea if you're interested in something like this. But it does take a lot of training before an individual is safe to use something like this on their own. In terms of ease of use and setup, it is multiple components, so it's not a single device. So there is a lot of setup involved. There's a lot of electrodes to be placed. There's battery packs. There's different cables that need to be used. It comes with a walker that can hold some of these devices that you need while you're standing and walking. But it's definitely something that you would need assistance kind of setting up, which is why there's so much clinical training involved. In terms of the cost of a device like this, you're looking at about $14,000 plus the cost of the training sessions, the PT sessions to kind of get you up and going. So again, here are the components of this device. Again, it's not a single device. It has a bunch of different components that are put together. Okay, so in terms of a session summary, we talked about really quickly what functional electrical stimulation is and how it can benefit you after spinal cord injury, the devices that are currently available here in the US, coverage and kind of cost of these devices, and finding a device in your community. So let's stop that. All right.
Excellent. Thank you so much, Jennifer. We have a bunch of questions. I'm going to pull up here. Let me go quick. Okay. So this first question involves an individual who has a young child. So a few questions. What's your perspective on using FES with abdominal leads for better sort of bowel management?
Yeah, so it's a really good question. Only one of the devices obviously will let you use stimulation to the abdominal area, but research has shown that any stimulation to the abdominal muscles can help with bowel bladder function and respiratory function, breathing function, because all of those muscles are required for those different movements. So I think, you know, if you have the ability to have a device where you can stimulate the core, you can get some carryover to some of those other benefits in terms of maybe bowel bladder and breathing.
Okay. When is it safe to use FES after sort of multiple fragility fractures? The mother asking this question, she understands that her orthopedic surgeon would have to give the okay, but should it be done slowly before increasing the intensity?
Yeah, so I would definitely get clearance from the doctor. And then if I were to be starting a program with this individual after the doctor's clearance, I would start with really low intensity muscle stimulation and make sure that there's no issues before I really built it up and ramped it up. So the ability to kind of alter the intensity of the stimulation would be really critical to the safety to make sure that you have a program that's appropriate.
Okay, great. Everyone, a couple of you have raised your hands, so I just ask you if you have any questions to feed them to me through the chat feature on your screen, and we'll get those posed to Jennifer. Okay, so this same individual, so she has an L2 SCI with some damage to T10. When she used an FES bike, it had to be turned up fairly high, and the machine kept turning to a non-active mode with her legs still moving. Does that mean that the settings should be changed for her, or that the FES would be hard for her to use?
That's a really good question. So that injury level is kind of in that gray area in terms of whether you're an upper motor neuron injury or a lower motor neuron injury. So if your injury is in that lower part of your spine, that's when your spinal cord turns into a bunch of nerves instead of just one long cord. And when that happens, if your injury is in that area, then your peripheral nerves, all your nerves aren't intact, and you need those nerves to be intact to use the functional electrical stimulation appropriately. So you have to have, if you're not seeing, if you have an injury kind of in that level and you're not seeing contractions, a clinician can alter some settings to see if we can make it work for you. But I have had plenty of individuals where I put them on and I've changed clinical settings as much as I could, and I still don't get the response that I want. And what that is showing me is that this individual just has an injury in that lower motor neuron where electrical stimulation just isn't going to be appropriate because you can't get that contraction. And so they're referring to the cycle going into a passive movement because that means that you're not getting that active contraction from the muscles to keep the cycle going. It's just then moving your legs around and you're getting range of motion. You're not getting the muscle contraction.
Okay, so once you already have the weak bones and have had these fragility fractures, how do you best prepare your body for FES?
Yep, that's a good question. So, again, speak to your physician, but the sometimes starting a possible standing program to kind of get some weight through your legs if you haven't had any weight through your legs at all. And again, the clinician who's setting up the FES for you, starting low on a lot of the settings and then slowly ramping them up.
Okay. Next question. This person is asking that she has seen FES used units on various websites, and they are, from some of the same vendors that you have mentioned. What would you recommend in terms of purchasing such bikes? Are they legit, or do they come with some other sort of challenges?
Yeah, so it's a really hard question to answer ethically. It's very common. When people no longer want their devices, or if somebody passes away and families trying to get rid of their device, these family members or these clients who had their devices, they want them to go to good use. So they give them to organizations, they put them on websites, they, try to get them to somebody who can use it. And it's absolutely wonderful. And I love the thought behind it, but these are medical devices. So you do need clearance from a physician to use these. And a lot of these devices are set up for the individual who initially had it. So if you're seeing a device on kind of like a secondhand, website or something like that, if you truly want to get the device that way, I would contact the company. So I can't speak for a lot of the companies. I can speak for restorative therapies. If you end up getting a used cycle from someone and you contact them for a price, they would reset up the device for you after your physician sends in something saying that it's medically appropriate for you. I would not recommend just getting a device and just using it, because there are some safety issues that you really have to look into in terms of using this device appropriately, which is why it's an FDA approved device and why it has to go through that medical pathway to get it. But I understand, because they cost so much money. And so it's nice to find them somewhere, right? So if you do find them, I say contact the company, reach out to them and see what they can offer you.
Okay. Next question. What are some of the key points that you have used in your letter of medical necessity that has worked effectively in securing insurance reimbursement?
So in terms of when I write my letter of medical necessity, I want to have my patient on the device as many times as possible before I write this. So, I work in an inpatient rehab unit. So sometimes my patients are only there for a few weeks. Sometimes they're there for months. So, if they're only there for a few weeks and they've only been able to use the cycle 2 or 3 times, I don't have the data necessarily to say, hey, look at how beneficial this has been to my patient. Whereas if I have a patient who's been there for a while and they've been on the cycle 10, 12, 16 times, and I can clinically document that it has improved their endurance during their therapy sessions, that I've seen less spasticity, or we've been able to go off of spasticity medication since using the device. If I can show that, they're not having orthostatic hypotension when I get them out of bed in the morning, were they passing out at first? And now after I've used this device regularly, is their circulation better? And can they go from a supine to an upright position right away because it's improved? So all of those benefits that I kind of talked about at the beginning of this talk, those are the things that you would want your therapist to kind of incorporate into the letter of medical necessity, to kind of say, hey, look, this is how it's benefiting my patient or client. The other thing is that I put in, just the raw data in terms of, on these cycles, you get data output, like how far you were able to cycle, how many minutes you cycled for, how many, watts of active power you put out. And you can kind of see that change and go up as you use the device more. So including kind of the raw data along with those other kind of objective findings in terms of like blood pressure and things like that will really make your letter of medical necessity strong.
Okay. On the Sigmetics device, you mentioned that there were 32 PT sessions. Would insurance cover those PT sessions, or does the company cover them?
Yeah, so the company doesn't cover them. That's why the device is their price plus the amount of the sessions. And some insurance companies may cover them and some may not. So I would say that for the majority of individuals out there, those would probably be cash paid PT sessions to learn how to use the device.
Do any of the machines that you use that have a leg sort of exercise feature, is it an assisted leg sort of device, or do you actually need to have motor function in
Great
your
question.
legs to use?
So FES devices can be used with complete paralysis. So that's what the electrical stimulation does, right? Is we're putting electrical stimulation into the muscles to cause the muscle to contract to actually cycle the cycle. So the good thing about these devices is even if you're not getting enough output from the electrical stimulation, they have motor backups. So there is a motor backup that can help the cycle go if you don't have enough strength from the stimulation to cycle the bike. So in terms of, using the bike on a regular basis, what you would normally see is, if I have somebody who comes in to see me, an outpatient, and they've been a complete paraplegic for 30 years, okay, and they've been cleared by their doctor and they say, hey, I want to come in and use an FES. When I stick them on the first time, their muscles have, shrunk and atrophied so much that when I put them on and I change as many settings as I can, I may not see those muscles contract right away. But if I put them on consistently or they use it consistently over a period of time, then they build that back up and I may see that change and they may be able to get off of that motor and use kind of their muscles to power the cycle. It's just like if before you were injured, if you were to go out for a run, right? And you hadn't run for 30 years and you go for a run, your first run's going to suck. You're not going to feel good. You're not going to get that far, but if you do it consistently, then you build it up. It's the same exact thing with FES because it is that sort of cardiovascular exercise. It's that muscle stimulation. So it definitely depends, on how long you've been out also from your injury.
Okay, very good. Question, how long can an RT pediatric model be used for?
In terms of like when you've purchased, I think like when you purchased
Uh,
it, like how long can it be used for?
it's not clear.
Okay. So
But maybe.
I'll speak to that. I'll speak to both. So in terms of like using it per session, most of the devices and most of the research says for leg cycling, 30 to 60-minute sessions is appropriate. And for arm cycling, 30-minute sessions are appropriate. So using a device on a pediatric or adult for that amount of time is kind of what the research shows. In terms of the longevity of the device, it depends how well you take care of the device, and it depends, how often you use it and things like that. A lot of the models, they do have warranties. A lot of them have, again, technical and clinical support if you're having issues with it. But I mean, I've gone into homes and kind of done upgrades on systems that people have had for, at least 10, 12 years. So I've seen these devices, last for a really decent amount of time, but over the years they've been upgraded, right? The first generation of most of these devices doesn't look like what they're selling now on the market. So if you upgrade kind of components, it tends to last longer.
Okay, so you spoke to the duration of the exercises. What about the frequency that is typically suggested?
Of the cycling, yeah.
Yeah.
So generally 3 to 5 times a week is what you're going to see. 3 is kind of the bare minimum in terms of seeing these carryover benefits of the bone density and the spasticity management and cardiovascular strengthening circulation. Honestly, again, it's just like exercising. If you exercise twice a week, you're going to get out of it what you put into it, right? And if you're slowly building yourself up to working 5 times a week, you're going to get a better benefit from it.
Okay. Next question. This person has used an RT300i before, but now his right hip has been dislocated and the right leg has turned inward. Would you see a possibility for him to use the RT300 again?
it really depends on the instability of that hip, right? So the muscles that you're stimulating with your RT 300 cycle absolutely can cause movement at the hip. So you wouldn't want to stimulate and contract those muscles if there's the opportunity for that to re-dislocate the hip again. The other thing to really think about is positioning also is really important. So positioning in your wheelchair to make sure that you're positioned adequate so that you're, lined up appropriately so that you're not putting excessive pressure through that hip. I would absolutely get clearance. If you came to me as a patient and said, hey, I need to be reevaluated for this, I would 100% ask for clearance from your physician before we even started. I would maybe want to see imaging of, what your hip looks like, and then kind of build from there.
Okay. This next question, someone has already purchased an exercise an FES cycle and out of pocket, and she wants to know if she can now go through the insurance sort of reimbursement process. How long post-purchase could you make that
You can
shift?
always go back through the process. So if you purchased it straight out and now you're hearing from me that, hey, insurance may cover it, it is 100% worth a try. What I can tell you is that it's not 100% going to be successful by any means, but it is worth a try. So what you would want to do is contact the company, and you would want to talk to usually like their financial division and, tell them, what you would need in order to do this, again, is make sure that you have your letter of medical necessity, you have all the documentation that you need from the physician, and then you can ask them to submit to your insurance. It's a long process. The quickest I've probably seen kind of insurance cover I've seen workers' comp move pretty quickly, but in terms of like private insurances, like a Blue Cross or something like that, like it's been 6 months. A lot of times I'll get an email 6 months later from the company like, hey, so-and-so's bike is being delivered. And I have to really think who so-and-so is because I haven't seen them for half of a year or a year. So it is a long process, but it's worth a try because you never know.
Okay. Next question. If someone is in that gray area range between the upper and lower motor neuron injury and was using the FES with some contraction, would you suggest more use with PT before purchasing one?
Yeah, I would want to see very consistent contractions and make sure that as you use the device that hopefully those contractions get better, right? So I would recommend, if you're ever looking to cash pay to just purchase one of these devices, I would say any way that you can, try to get on it as often as you can to make sure that it's going to be beneficial to you. The last thing I would want is for somebody to purchase a device like this and then it just not be appropriate for them and not get the benefits out of it. So if you have the opportunity to go back and use it more frequently, I would say absolutely.
Okay. From your experience, what needs to happen so that insurance companies would start adopting coverage of this unit?
Yeah, insurance, they don't like to fix things before it's broken, right? So that's the biggest issue is, after you have osteoporosis and after you have wounds and after your heart and your lungs are weak because you haven't been doing cardiovascular activity, they will give you and cover all of these medications to make it better, right? But they won't do anything early on preventatively to stop this from happening in the first place. And that's what I think a lot of the research that is being done regularly is trying to prove, is that, hey, insurance, it's going to actually cost you a lot less if you buy this individual a $20,000 cycle versus paying for all their medical bills down the line because of all these issues that come up, right? And I'm not saying that an FES cycle is going to fix all your issues, right? You're still going to have, changes with your body as you progress through life with a spinal cord injury. But the research has shown that so many of those issues can be, slowed down or actually made improved with the use of it. So I think insurance needs to jump on, the preventative bandwagon. I don't know if that's going to happen. Again, the VA and workers' comp have jumped on those bandwagons, and I do see really good coverage from those too. But in terms of private insurance, it's tough.
Okay. Next question. Would any of these devices have any application for abdominal or back muscles?
Yeah. So the only device that I talked about that you can stimulate abdominal and back muscles are the restorative therapies devices. So all of their devices, you can get anywhere from 6 to 12 channels, and you can choose which muscles you're stimulating. The other devices have pre-programmed muscle groups that you have to stimulate during the activity. The restorative therapies allows the clinician who's setting you up on the device to choose which muscles to stimulate. So when I use a restorative therapy cycle in at the hospital, that's what we have, based on the presentation of the individual, I'm going to pick and choose which muscles I think are most beneficial for that person.
Okay. Well, that does it, Jennifer.
All right.
Thank you, everyone, for tuning in. As I mentioned, we've been recording this presentation, and you'll have an email from us in your inbox by tomorrow morning, 8 o'clock hard time, so that you could view it again. Thank you, Jennifer, for this wonderful sort of collection of presentations that you've made. I think we've now covered all the big stuff involving electrical stimulation and spinal cord injury. And Jennifer is working on one more presentation, at least, hopefully,
Yeah.
for next month, which she and I are still kind of working on, and hopefully we'll be able to bring that to you next month. Thanks everyone for tuning in, and thanks also to the Christopher and Dana Reeve Foundation for making these presentations possible. Have a good rest of the weekend, and thank you again, Jennifer.
Thanks. Bye.
Bye-bye, everyone.